When it comes to relieving back pain, sometimes surgery is the only option. And when it comes to our spine, you want to make sure you're getting the very best care. Here with insight on this is Dr. Elliot from Eastside Neuroscience Institute, and you're also a neurosurgeon at Overlake Medical Center. Is that correct?
I am.
You're busy.
Very busy, yeah.
Lots going on. So what is Eastside Neuroscience Institute for someone that hasn't heard of you all?
Sure, so the Eastside Neuroscience Institute is actually a joint venture between Overlake Medical Center and EvergreenHealth. Basically, we are encapsulating, neuroscience care for the entire Eastside community as well as the greater Puget Sound area. So we cover neurology and neurosurgery and then spine surgery as well.
That's amazing. And when someone is debating if, this back pain is enough that they should get spine surgery, what should they know to determine if surgery is definitely the option?
Sure. So in general, patients should be tapped in with their primary care doctor, which means they should be seen on a regular basis. If they have a complaint of back pain, usually patients will start with some sort of conservative treatment, including physical therapy, medication, and then if that doesn't resolve it, they usually move on to some sort of imaging, so an MRI or a CT scan.
And what are the typical symptoms or conditions that definitely require spine surgery?
So things like spinal cord compression, nerve root compression that can lead to weakness in the arms or the legs, or spinal tumors generally do require surgery up front, and those are things that we treat very seriously. Other conditions leading to pain, numbness, weakness, or tingling are all things that we try to treat with conservative treatment first, but if those things fail, that's when we discuss surgery as an option.
And how long is the recovery with the surgery after something like that? I'm sure it's case-by-case basis, maybe?
Yeah, so it totally depends on what sort of surgery you get. For our more minimally invasive procedures, it can be as soon as 2 weeks. For things that are a little bit larger, it can be up to 2 to 3 months, depending on what sort of procedure is done.
And you touched on this earlier, but the non-surgical ways to treat back and neck pain. I recently threw my back out, and that was the first time, so I can sympathize with a lot of people when they're complaining about their back. You don't realize how painful it is until it happens to you. So you touched on this, but what are some of those treatments again? Physical therapy and anything else that you'd recommend?
So back pain is actually the second leading cause of emergency visits in the United States, and so it's very, very common.
Okay.
Most of the patients do not need any sort of surgery, and so we always recommend things like physical therapy, but other options include medications, and then they can include things like epidural steroid injections, nerve blocks, and that sort of thing.
Wow. And when a condition does require spine surgery, what are some of the latest advancements in this technique that you want to talk about?
So some of the things that we're really excited about these days are things like spinal robotics, so specifically using a robot to help with the surgery to make it safer and more efficient, and also ultra minimally invasive techniques. So in the past, we've done a lot of our surgeries minimally invasively through a small tube. Incision is about 18 millimeters. But these days, we are actually doing surgeries through even smaller incisions using an endoscope. So we're talking about 8 millimeter incisions, so very, very small.
That's so small. And how has it been through your career, and how it's changed already dramatically with the technology?
Yeah, so I would say that every year we are seeing newer advancements in our field. Even within the short course of my career, there have been a lot of strides specifically in robotics and spinal endoscopy. One of the things that is really popular these days is enhanced recovery after spine surgery. So trying to minimize the time that patients spend in the hospital, out of work, and getting them back to their active lifestyle as soon as possible.
Well, we cannot thank you and other doctors like you so much for getting us all back and up and running. So thank you so much for being here and for all this information.
Absolutely, my pleasure.
Yes. So to learn more about what we discussed today with Overlake Medical Center and the Eastside Neuroscience Institute, please visit the website right there on your screen.
This portion of New Day Northwest is sponsored by Overlake Medical Center.